this is Daisy. I am presenting on the impactful use of EHRs by primary care physicians, and I do want to note that EHR stands for Electronic Health Record. So, primary care EHRs assist with consistent preventive care, increase ease of medication ordering and education, decrease ER utilization, and can even assist with assessing historical patient records. And of course, no protected health information is being shared in this image. I just wanted to give a quick look at what the snapshot page of an EHR looks like for a patient. This just kind of runs over their demographics and most recent, any tests that have been run, just the most recent data sets for those. So what is the point in an EHR? So electronic health records help promote patient safety, interoperability between healthcare physicians, and assist in patient engagement by providing patient portals. Of course, this data is stored within the EHR so that there is a quick and efficient way for notes to be published and also disseminated between providers. If you look at the picture on the screen, you can think of the larger branch as the primary care setting. These physicians typically look at the patient holistically rather than in any niche form, whereas the smaller circles are likely specialists such as a pulmonologist, maybe even the pharmacy team or a nephrologist. The smaller circles, of course, there's still branch to the larger circle. All of these physicians and healthcare professional staff, they can see each other's notes and they're all helping the same patient. So it's important for them to see each other's notes. This helps prevent any redundancies. We don't want the primary care doctor to order a Lantus Solastar injection for a patient and then the endocrinologist turn around and order the same thing a week later. It just helps prevent small errors like that and redundancies. So, patient outcomes. I first wanted to highlight clinical care pathways within EHRs. VCU Health Systems or Virginia Commonwealth University, they use Epic Care as their main EHR, and they do have clinical care pathways instilled in there in data sets. So if a patient is diagnosed with diabetes, that tells a nurse that may be also helping the patient that, hey, we need to follow steps 1 through 5 to make sure the patient's good to go. They now have their diagnosis. We want them to regularly test their A1C levels. That means we need to place in orders for a one-touch glucometer, some test strips, alcohol wipes, lancets, all that fun stuff. Make sure they have all of their diabetes testing supplies. It's more of a flow chart that they kind of go down just to ensure that all care gaps are closed before the patient continues on. And then, of course, disseminating patient information for the purpose of improved health outcomes is heavily centered on the proper utilization of the EHR. What this means is that the nursing staff, any care coordinators, the physicians themselves, they need to be up to date on the system itself. They need to be aware of any modifications that can be made or have been made. If they're not properly using the electronic health record, it's kind of hard to tell if the patient will have a positive healthcare outcome from that. And then, of course, if there's an increase in physician office use of EHRs, it can help prevent unnecessary ER/ED visits by patients. Some patients will routinely go to a hospital just for the sake of getting refills of prescriptions, whereas typically the primary care doctor would take care of this for them. And also having a patient looped in with a primary care doctor the doctor can kind of explain to the patient the difference between primary care setting and urgent care and the ER. Of course, we only want to go to the ER for very drastic things. If your provider's out of office for 2 weeks and you really need a refill, obviously you can go to an urgent care for something like that, and then heavily rely on primary care for everything else. So some methods, provider use and retention. EHR usage was first granted by the government through the HITECH Act in 2009. There's a ton of other fancy technology things that came out in that act as well. EHRs was the most important to me for obvious reasons. And of course, there is an incentive program for providers that implement EHRs. The government really wanted healthcare clinics to move away from paper usage for obvious reasons. It's just not as convenient and as cost effective as well. And then here's an example of a patient login screen for their electronic health record. It kind of looks the same on the provider side as well. You just have to enter your password in and probably like another code or two just to make sure the right person's logging in. And then I notated at the bottom the two EHRs I've used before, such as Citrix and EpicCare. Citrix is used by EVMS Medical Group, so I love looking at that one, even though it's more of a dinosaur. And then EpicCare is the fancy one that Bon Secours and VCU uses. Those are more up to date. And then for my conclusion, just kind of roundabout, it's very obvious that EHRs are beneficial for both patients and primary care health staff. I do want to kind of highlight the comfortability with technology for patients, because a lot of the older patients you may come across with using EHRs, they probably don't know how to log in, how to properly fumble through the tabs to see exactly what they're looking for. Maybe they're trying to see if their walker order has been placed or their wheelchair order, see if compression stockings were ordered for them. There's obviously dedicated healthcare staff that would help with this, and I do want to highlight that Medicare and Medicaid patients or recipients, they do have community health workers with most of those insurance plans, those MCOs that help with things like this and also help them get access to tablets and phones. And then, of course, if you have a patient that has like a Freestyle Libre or a Dexcom system or as a continuous glucose monitor, a lot of the times the doctor will not let the patient leave the clinic until they've been properly trained on how to read their A1C levels from their phone. The sensors for the CGMs do connect to patients' phones now, which is very beneficial for them. And then, of course, for the staff, they don't have to fumble through papers as much. Technology is just more cost effective. You don't get as burnout from it as you would fumbling through a folder for a patient. And then, of course, helps prevent those medication errors and promote provider collaboration. And that's my references. Thank you.